Our topic for today is all about the safety practices in sports. And syempre, pag sinabi nating sports, hindi mawawala yung tinatawag nating injuries. Okay, so most of the time or most of our topic for today is all about the injuries. Okay, kung ano yung mga dapat natin gawin when it comes in injuries, ano yung mga different types of injuries na meron tayo. So, i-discuss yan ngayong araw na ito ni Sir RG. But before that, or before tayong mag-proceed sa pinaka-main topic natin o sa mga different injuries na yan, define muna natin kung ano yung tinatawag na injuries. So class, when we say injuries, these are the damaged tissues or organs which occur when it encounters trauma or physical force that is greater than what it can resist or absorb. So the tissues are able to withstand varying degrees of stress and strain, but it will break down if it experiences an impact that is stronger than what it can tolerate. So class, always remember this, na sa body natin, meron lang yung mga capacity. And once na na-exceed yung capacity ng ating body, ay may tendency na pumasok yung tinatawag natin na injuries, or dito tayo magkakaroon ng injuries. For example, ako si Sir RG, most of the time, more on physical activities yung ginagawa ko. And syempre, pag araw-araw ko yun ang ginagawa, mapapagod ako. Okay? Pero hindi ko pa rin siya tinigilan. So therefore, doon papasok yung tinatawag natin mga injuries. Pag sobrang pagod na yung body mo o yung physical body mo sa isang activity, mabubugbog yan. So once na nabugbog yan, mas mag-worsen yung situation. Okay, so doon na ngayon papasok yung tinatawag natin na injuries. Okay, so that is injuries. And kanina class, may nabanggit akong forces or physical force natin na tinatawag. So now, these are the different forces na meron tayo when it comes in injuries. So class, tissues and organs react to impact and direction of force. Meron tayong tatlo, which is the tensile forces. Pag sinabi nating tensile force, these are those that act away from the center of structure, causing pull or stretch. Yun lang po yung tatandaan nyo. Ayan, i-annotate natin dito ha. Causing pull or stretch yung tensile forces natin na tinatawag. Next naman is yung compressive forces. That is the impact. Ang impact nito ay dun sa center, no, ng ating body, which is causing bend or fold. Kadalasan yan dito sa part ng ating elbow, yung mga forces na ganyan. Okay? Next naman natin is shear forces. These are the opposing forces towards the different ends of the structure, causing it to twist. Para mas mabilis nyong matandaan na itong different forces natin, ganito lang yan. Tandaan nyo lang class, pag sinabi natin tensile forces, it is all about the pull or stretch. Then pag sinabi naman natin compressive forces, it is all about the bend or fold or bending or folding natin na tinatawag. Shear forces naman class, tandaan nyo lang, is twist. Tensile forces, pull or stretch. Compressive forces, bending or folding or bend or fold. Shear forces, twist. So that is the three force when it comes in injuries. So after ng mga forces natin, punta naman tayo sa ating next topic, which is all about the common sports injuries. Meron tayong dalawang injuries na tinatawag. That is acute and chronic injuries. So iisa-isahin natin ngayon yung mga different examples na meron tayo sa acute injuries. Again class, these are the most common, or ito yung mas kilala pa. Actually, marami tayong acute injuries, pero dun tayo sa mas kilala o sa mas alam natin. So what are the most common acute injuries? So mga kapi, actually there's a lot of acute injuries na meron tayo. So dun lang muna tayo sa common o sa mas alam nyo or mas kadalasan yung na-encounter when it comes in sport. So let's start this with our first acute injury, which is the sprains. Okay, so class, sprains are overstretched ligaments, no, that stabilizes and limits joint mobility. So when the joint is forced into a position that is beyond its normal range, it will overstretch the ligament. So kadalasan nyo po yan ay nararanasan once na kayo ay natatapilok o nagkakamali kayong ng tapak kagaya ng dito sa ating picture. Okay? So tandaan nyo lang class, pag sinabi nating sprain, that is ligaments. Okay, or stretching ligaments or stretched ligaments, that is sprain. Ligaments yung pinag-uusapan in class. A completely torn ligament may need surgical reconstruction before the athlete is allowed to play again. Pero kung mild lang naman siya or hindi siya ganun kalala, pwede naman, it takes weeks or months para gumaling. Pero kung sobrang severe na, yun na yung kailangan ng surgical reconstruction natin na tinatawag. So, a sprained joint will take several days or months to heal. It depends on the severity. Okay, so depende kung gaano ka lala yung sitwasyon natin. And another example ng ating sprain or under ng sprain, meron tayong tinatawag na anterior cruciate ligament or ACL. Ito ay kadalasan natin naririnig sa sports na basketball or volleyball. Okay, common na common to. So, si ACL or si anterior cruciate ligament ay isang example ng sprained ligament. Again, anterior cruciate ligament is a commonly sprained ligament. So, the ACL class, it is a connective tissue that helps stabilize the knee every time the muscles contract. So, pag sinabi natin ACL, knee yung tinutukoy dito o yung tuhod natin. So, the injury commonly occurs when the knee twists while weight is placed on it due to improper landing. And kadalasan i-experience natin ito, yung ACL na ito, once na for example, nag-dunk tayo dun sa ating ring. Then pagbaba natin, mali tayo ng landing or hindi tama yung landing natin, for sure, ACL ang pwede nating maranasan o makuhang injury. Again, when we say ACL, it commonly occurs when the knee twists while weight is placed on it due to improper landing. So class, anterior cruciate ligament tear. Okay, so ito po yung tinatawag natin na ACL. Okay, so ito, ina-annotate ko siya actually. Ayan, ito po yung tinatawag natin na ACL. And once na napunit na siya, ayun yung tinatawag natin na sprained ligaments. Okay? So, yan. So, the injury usually takes several weeks or months to recover depending on its severity. Okay, so a surgery is recommended for individuals who suffer a complete ACL rupture. Pag sobrang lala na siya, hindi na siya kayang ipahinga or hindi na siya kayang bigyan ng alternative ways para gumaling, kailangan na natin ng surgery. Okay? So, most of the time, pag sobrang lala na talaga, as in talagang punit na yung ligaments ninyo o yung ligament ninyo doon sa tuhod, surgery talaga yung kinakailangan doon. And syempre, dito meron tayong tinatawag na duct tape or medical duct tape. So, class, hindi ito yung duct tape na nabibili lang sa Pandayan Bookshop or sa National Bookstore or sa kung saan mang tindahan din sa bahay ninyo, ha? Okay, this is a medical tape na kung saan yun yung nilalagay sa ating tuhod or dun sa knee natin na tinatawag, ayan siya. Okay, so that is the medical duct tape na nilalagay. Okay, so class, tandaan, kahit na meron na tayong ganun o nalagyan na siya ng ganun, hindi kaagad dapat tayo nagpa-participate sa isang sports. Kailangan na pagalingin muna natin yung damaged part or injured part ng body natin. Okay, it takes time or it takes several weeks or months, actually year pa nga yung iba, bago gumaling ito or bago tayo maka-recover. Huwag niyong pipersayin yung sarili nyo kahit na kaka-opera nyo pa lang or kahit na inoperahan na kayo a week ago or a month ago. So, kailangan nyo pa rin magpa-check sa doctor nang sa ganun sigurado kayo. Okay? So, that is anterior cruciate ligament or ACL. So, the second acute injury is what we call strain. Okay, kung kanina sprain, this time strain naman siya. And syempre, pag sinabi natin strain, it is a twist, pull, or tear of muscle or tendon. When we say tendon, class, this is a cord of tissue that connects a muscle to the bone. Okay, so yan. So it is also an acute or non-contact injury that results from overstretching or overcontraction. Ito rin tinatawag natin na pulikat. Okay, kadalasan natin to na experience sa swimming or every time na nagsiswimming tayo. Okay, so the most common strains are located at the lower limbs such as a hamstring and calf muscle. Okay, so class, pag sinabi natin hamstring, ito yung yung nasa likod ng hita natin. Okay, yung taas ng alak-alakan. So that is hamstring. Doon kadalasan nakakaroon ng overstretching or overcontraction natin na tinatawag. So another term ng ating overstretching or overcontraction is yung strain. Okay? So, ano ba yan? So, this is the hamstring strain. Ito yung sinasabi ko sa inyo, yung nasa likod ng hita ninyo. And as you can see, kung mapapansin nyo, parang napunit yung muscle na nandoon sa inyong hamstring. Okay? So, that is strain. Some types of strains involve the complete rupture of the muscle tendon unit, and this requires surgery before the athlete is allowed to play. So, the healing process usually takes 6 to 8 weeks. Okay? So, class, as you can see dito, medyo mild pa lang. Or, nasa grade A pa lang yung strain natin. Hindi pa siya ganun kalala. So, Sir RJ, ano po yung grade A na yan? Ano po yung mga different grades na yan na tinatawag? So, yan. So, class, sa muscle strains, meron tayong different grades. Meron tayong grade 1, grade 2, grade 3, or mas kilala sa tawag na grade A, grade B, and grade C. Okay? So, pag sinabi natin grade 1 or grade A, ito yung parang medyo reddish pa lang yung natin, yung damage ng strain natin. Hindi pa siya ganun kalala. Medyo red lang siya, parang swollen. Namamaga lang siya, ganun. Okay? Sa grade 2 naman, meron ng konting punit yung muscles ninyo. Okay? So, sa next naman, sa grade 3, ito na yung pinaka-severe, yung as in talagang punit na yung muscles ninyo on the particular body part. Okay, so that is the 3 grades when it comes in muscle strain. So again, class, depende sa sitwasyon kung gaano kalala yung strain ninyo, bago siya gumaling. Okay, so para mas mabilis nating maintindihan, para mas mabilis nyong maintindihan, let me discuss to you, or let us differentiate the difference between strain and sprain. Pag sinabi natin, class, na sprain, this is all about the overextending or tearing of ligaments. Pag sinabi naman natin strain, this is all about the muscles or tendons. Okay? And another thing, pag sinabi natin sprain, commonly sa ankle siya nagkakaroon. Okay? Or commonly, ankle yung pinaka-involved na body part natin. And pag sinabi naman nating strain, this is more on the lower back and the hamstring muscle in the back of our thighs. Ito na nga yung sinasabi ko sa inyo kanina. Again, pag sinabi nating sprain, tearing of ligaments. Pag sinabi nating strain, tearing of muscles or tendons. Pag sinabi nating sprain, kadalasan ankle yung involved. And pag sinabi naman nating strain, hamstring o yung lower back yung ng body part natin yung involved. So that is the difference between strain and sprain. Okay, so after na ating sprain and strain, let's move on sa next injury or next acute injury na meron tayo when it comes in sports, and that is the fracture. Okay, pag sinabi natin fracture, class, this is the most common in the upper limbs such as the hand or forearm. Okay, so kung mapapansin nyo dito sa image na nandito, okay, so that is the arms fracture or arm fracture natin na tinatawag. Okay, so syempre meron din tayong mga different fingers fracture. O kadalasan itong nangyayari sa basketball, volleyball, or once na sobrang na-damage on sobrang lakas ng impact nung sports na nilalaro natin doon sa body natin, talagang nagkaka-fracture o yung mga hindi inaasahang pagpagsak sa isang sports o mali tayo na itukod na kamay o paa o na itukod natin yung tuhod, talagang magkakaroon tayo ng fracture o yung crack doon sa mga bones natin. So, okay, so fractures are common in growing bones because it is less dense. And yes, that's right. Okay, so kadalasan nagkakaroon tayo ng fracture sa mga hindi ganoon katigas na mga buto natin o yung medyo malambot pa na mga buto natin, lalong-lalo na sa part ng mga fingers natin. Okay, kasi yan yung pinakamalambot na part ng ating buto. Okay, so yun yung kadalasan nagkakaroon sa atin ng fracture or ng crack sa bones natin. Okay, so class, when we see fracture in the upper limb, it occurs when individuals support their weight using their hands when they fall or sleep. So, kagaya nga ng sabi ko, sa sports, may mga tendency na may mga mali tayo na itutukol o na isusuporta dun sa body natin. So, yun yung nagkakos ng fracture. Syempre, hindi lang sa sports, pati na rin sa mga gawaing bahay, di ba? O yung mga different unwanted accidents or incidents na nangyayari sa atin. Okay, yung basta mali tayo ng pagsuporta o mali tayong naitukod, yun, magkakaroon talaga tayo ng fracture, lalo na kung sobrang taas pa nung binagsakan mo. Okay? So, nakukuha. Pag sinabi natin fracture, hindi naman siya totally baling-bali yung buto. Okay? Pag sinabi natin fracture, parang may crack lang siya. Okay? Hindi siya yung totally na nabali na yung buto. That's not fracture. Okay? Yung talagang ano lang, crack lang siya dun sa bones natin. Okay, so next natin, class, is fracture. We all know that there are different types of fractures. And syempre, yung healing period niya is between 3 weeks to several months. Paano several months? Depende yun kung gaano kalala yung fracture na meron ka. Pero kung sobrang mild lang naman ito or easy lang naman o hindi naman siya ganun kalala, it takes weeks or 3 weeks. No? Okay, so depende dun sa lala ng injury natin. So it is normally treated with the immobilization by attaching a fixator or a cast. So class, balik lang tayo dun sa una nating picture. Ito po yung example ng fixator o yung cast natin na tinatawag. So yan, once na nagkaroon ka ng fracture, yan po ang ikakabit sa inyo. Okay, so may purpose naman pala yung cast na yan. Actually, class, yung cast na yan pang support din sa arm ninyo. Okay, so next natin sa acute injuries is what we call dislocation. Okay, so ito po yung difference between fractures and dislocation. Baka ito yung napapansin nyo o napagpapaliktad ninyo. Pag sinabi natin dislocation, ibig sabihin lang ng class na dislocate yung bone mo. Okay, wala siya dun sa proper alignment niya. And dislocation, it is commonly occurs in joints that allow greater range of motion. Ito yung sobrang na-overpower. And sa sobrang overpower, na-disalign na o na-dislocate na yung particular body parts mo. Okay, so the most dislocation are located at the upper limbs such as the shoulder and elbow. And gano'n na rin sa mga fingers natin, nadi-dislocate din yan. Okay, pati yung knee, nadi-dislocate din yan sa may gawing ankle, nadi-dislocate din siya. Pero kadalasan lang talaga yung most common cases natin is more on upper limbs. Sa shoulder at sa elbow talaga yung dislocation natin. So these joints are commonly affected when an individual uses his weight when he falls. Okay, so nadi-dislocate yung body part natin once na lahat ng weight natin binigay natin doon sa yun yung pinang support natin. Okay, para lang din siyang sa fracture, pero mas malala yung dislocation dahil talagang na-align o na-disalign rather yung particular body parts mo. Sa fracture kasi crack lang hindi siya ganun ka-severe. Dito kasi sa dislocation talagang ibabalik pa dapat yung buto ninyo. Okay, so medyo masakit itong part na ito. Okay, dislocation. And kadalasan ito nangyayari sa mga sa mga soccer, sa volleyball din. May encounter ako na ganito sa volleyball tsaka sa basketball. Okay, yun talagang baliyahan talaga to the point na parang masisipa pa yung paa mo, talagang sa sobrang takbo din at the same time talagang nadi-dislocate talaga yung mga soccer player natin kung makakapanood kayo ng game. Ganon, yung kadalasan na injury na nakukuha nila. So furthermore, the individual will not be able to move the affected limb. The pain will be relieved once the bone is repositioned. So class, once na nagkaroon ka ng dislocation, talagang sobrang sakit niyan. Hindi titigil yung sakit na yan hanggat hindi siya bumabalik sa dati. Kaya nga meron tayong tinatawag na bone reposition. Okay, kailangan talagang ibalik yung particular body part mo sa dati niyang kalagyan nang sa ganon huminto yung sakit. Kagaya nito, sa picture natin, kung mapapansin nyo, diba, dislocate talaga yung finger niya. Okay, so kailangan itong ma-disalign ulit, ma-aligned ulit o ma-reposition ulit nang sa ganun mawala yung pain na nararamdaman niya. Okay, so the next one naman natin is what we call concussion. When we say concussion, class, it is a life-threatening injuries because they disrupt the normal function of the brain. So a severe blow to the head could cause the blood vessels in the brain to rupture, and as the blood leaks out of the ruptured blood vessels, it will accumulate inside the skull. Itong confusion nito, medyo traitor itong part na ito. Mayroon akong napanood sa YouTube na parang documentary about sports injuries. And then, yung isang player doon, actually rugby player siya. Okay, nagkauntugan silang dalawa ng kalaban niya. So ngayon na nagkauntugan sila, akala ng lahat normal lang na nakatayo, normal lang na nagkauntugan, napahiga silang parehas, pero yung isa hindi agad nakabangon. Pero after ng ilang segundo, bumangon na din naman siya. Nang pagkabangon niya, akala niya okay lang siya. Okay, so after the game, doon lumabas yung resulta. Okay, after the game, bigla siyang nag-collapse. And then, nung dinala siya sa ospital, meron na pala siyang concussion na tinatawag or nagsasuffer na pala siya sa concussion injury. Okay? So, ibig sabihin nun, nagkakaroon ng impact between the two people. Okay? Yung sobrang lakas na force, pag nakauntugan, di ba? Yung parang hindi man siya makita physical, in your physical body yung result, pero once in-scan na yan o sa loob, so internal part ng body mo, doon malalaman. Okay, doon makikita na naapektuhan pala yung brain mo. Okay, so conclusion. So class, the accumulated blood will put pressure on the brain, blocking the blood supply to different areas of the brain. The accumulated blood will put pressure on the brain, so blocking the blood supply to different areas of the brain. So class, if the condition is not resolved immediately, the brain starts to die. So as much as possible, bigyan agad natin ito ng action. Tumawag na kaagad sa pinakamalapit na hospital or dali na agad siya sa pinakamalapit na hospital. Why? It is important for the individual to go to medical facility as soon as possible. Nang sa ganon, hindi na mag-worsen yung injury. Okay? So, hindi ito nagagamot ng kahit anong benda o ng yelo or ng kahit anuman na pwede nating gawin for as alternative treatment. Kailangan talaga siyang dalhin sa pinakamalapit na ospital dahil may tendency na huminto na yung brain niya. Okay? So, his or she's brain will going to die. Okay, so that is the 5 acute injuries when it comes in sports. Meron tayong tinatawag na sprain, strain, fracture, dislocation, and concussion.